So, as we discussed, you're also now in the instructional end of this business. And tell the viewer how truly important the training is for a job like this. A lot of jobs require training, but most of the time it's learning the nuances of the product, learning the nuances of the office itself, but it's not always in the interaction of people, unless it's a service business, typically, like fast food and things like that. But outside of that, this seems like it's entirely based not just on the out strategies and learning things that they need to learn for the job itself, but it seems like 70 to maybe, and you can correct me, 80% of this is how you have to work with these people. So you're talking about people ignoring, so people are getting ignored. Explain the difficulty of maybe finding good staff, if it is, but talk about the importance of the training of something like this and what type of person it might take who wants to do this, that looks that this is a career path for or whatnot.
So it's a good question. I think at some level you have to be somewhat of a caretaker. You have to like helping people on some level to truly make a difference, and you have to know that there are boundaries between a patient and a staff member, and sometimes those boundaries can be very difficult to adhere to, especially in the recovering community. People that are members of Alcoholics Anonymous or Narcotics Anonymous often feel like because they got off of drugs and alcohol that they can be in the field of behavioral health.
That's very common?
And it's very common, and actually it's not true. It's a misnomer. Just because you're in recovery does not mean you should be in the treatment industry. The two are not synonymous with each other. Have people in recovery been in the treatment industry? Of course, and they've thrived and they've done well, but it isn't for everybody. And so I think the following. I think if you're an unethical person, I think it's like cancer. You're an unethical person. I think that slippery slope really can't be corrected, and if it can, it's minuscule at best. So those are the kind of people that you have to be careful of, and you have to vet them out of the industry. Behavioral health attracts a lot of pathological people, so that even makes it more important that supervisors and ownership and clinical directors are extremely aware of these bad actors. And so, the other question is, can you teach empathy? Can you teach compassion, or are you born with it? I think as an expert in this field, as an instructor, as a leader, I think the answer is you're mostly born with empathy and compassion, but I think you can learn just enough if you really want to be in this field to be effective. The number one most important thing is that a patient wants to feel like they have hope, that there's a solution to their problem, and they want to know that somebody actually cares about them. So, I make a big deal about being ignored because the stigma of mental health is that they're different, they're stupid, they're retarded, they're criminals. I can do things to them that I can't do with whatever normal people are and get away with it. And the fact is that that's not true. And the fact is that that's still a crime, and that still sucks, and that's still unethical. And in fact, it should be the opposite. People should work harder to assist these people. Mental health, behavioral health patients have good memories, and they're going to forget what happened in group. They're going to forget what medication they were on, but they're never going to forget the kindness that they got from a staff member. Never. That never goes away. And that is 100% across the board. That if you're a little bit patient with them, a little bit kinder, a little bit more empathetic, it works. And if you take a step back and you look at it strictly from a statistical point of view, by the time somebody gets to treatment, they've been in, their life is a mess. Their life is unmanageable. Most people go through multiple treatment episodes. There are different kinds of treatment. And depending on who you are, what you are, and what happened to you, you could be in treatment a good portion of your life. And let's say you're in treatment, in and out of treatment for 10 years, which is typical. On and off, on and off, on and off. You're not going to change the way somebody is within 30 days. That's not going to happen. But you can manage the symptoms, and you can start to plant the seeds of hope for the individual. So it's really important to manage expectations of staff, of what they're really dealing with. Staff gets frustrated because a patient mouths off to them, or disrespectful to them, or can't make their bed, or can't cook for themselves. Yeah, that's right. That's where they're at. They really can't because they don't know. And that's part of the reason that they're sick, trying to get better. So we have to modify expectations of staff and what we can and can't do, and what they're capable of doing over a period of time. So I don't know if that answered. I think that answered your question.
Well, no, it definitely does. I mean, you outline what type of person is necessary to be a therapist, a counselor, somebody that wants to be in this field. A little follow-up on that. What's the typical time frame that someone sticks with this? It seems like it could be stressful. You talked about a scenario that got violent. So there's probably a chance of violence at any time. Maybe it's not common, but the possibility of it. So is there a burnout involved? I guess my question for you is there a burnout involved with people that do this, that get into this field?
Very, very high level of burnout.
Really? So there's high turnover?
It is high turnover.
Talk about that.
And it is stressful. The system is set up to fail right now because there's too much focus on documentation and what are you doing wrong, as opposed to what are we doing right. And insurance companies have way too much control over dictating how treatment is going to be. So the systems that people have to put in place are not cost effective. They take up way too much time. As a result, the patient and their families don't get face time, don't get the treatment that they deserve, and it sets up this sort of recycling of families and patients from one treatment center to the next. So a therapist, one of the hardest things about being a clinician is sometimes there's two things. One is you never know if your interventions work. There's a chance that you'll never know. You do all these treatment plans, you meet with the family, you do the best you can, patient leaves, sometimes you never hear from them again. That's hard on the psyche.
I'd say.
And it's hard to live with that, especially when you're a type of person that is a caregiver, that really goes the extra mile, and is really interested in somebody's well-being. So there is a high rate of burnout because of that.
Do people get attached, like you said, so that when said person leaves, or they're no longer in the facility or no longer being treated, there was an attachment to that person? People get this way with pets. I can only imagine, when they're training animals or whatnot, I can only imagine it's more so with humans, where it's that you keep having loss, and then the next person's gone, and the next person's gone, and they're out of your life, where you had a very intimate time with them for a month.
So that's where good supervision comes in. There's a lot of countertransference that goes on, and a lot of the countertransference is when it's transference, countertransference, when a therapist identifies with a patient and associates very strong feelings, and it may not be per se about the patient, it may be about someone or something else, but yet they have these feelings. So they have feelings of attractiveness, or they're attached to them, or they feel like they have to save them, and you could imagine the patients feel the same way. that they have an attachment as well, and that's where really strong supervision comes in. We don't sell shoes in this industry. We're a service industry. We're a FaceTime industry where personal relationships is really where it's at. And so the other part of this is that counselors, with all their experience, with all their education, with all the interaction, many counselors feel like a fraud. They don't feel like they're being effective because the population of dual diagnosis, whether you're schizophrenic, bipolar, anxiety, heroin addicted, cocaine addicted, alcohol addicted, cannabis addicted, combination of all of them, it's a tough crowd. And you, a lot of times as a clinician, as a what I like to call a change agent, you don't feel like you're doing any good because it seems like nothing is getting through to the person. And so you have to understand that the expectations have to be realistic. You have to know that you may not get those secondary gains that you're looking for. You might not get, thank you, you helped me so much. Or I really appreciate the fact that, you know, you confronted my belief systems and now I'm sober and now I'm taking my meds because they're important. You may not get that. You may not get the Christmas present under the tree. Some of the patients that are successful are the worst patients in treatment. They're a terror, and they leave under terrible circumstances, and you hear about them, you know, a couple of years later, and they're clean and sober and they're thriving. So it's a hard industry. It's not for everybody. You know, strictly as a clinician, you're not going to make a lot of money. So it's not financially rewarding. You know, it's similar in this way to being a teacher. You know, teachers and counselors do amazing things, and I wish that the salary schedule for these types of people was much higher than it is.
That reminds me of a question that I was going to ask you, but I have one I'd rather jump to based on what you said, and then I'll get to that one after I ask you this one.